Welcome to USMLE Drone. Let's dive into some ophthalmology anatomy of the eye today. Let's read the question. A 26-year-old male is brought to the emergency department following a fist fight. He presents
with swelling and bruising around the left eye, difficulty with ocular motility, and numbness in the left cheek. On examination, there is a noticeable enophthalmos and decreased movement of the eye when the patient is asked to look laterally, then inferiorly. A CT scan confirms an orbital fracture.
Which of the following muscles is most likely injured?
A. Inferior oblique, B. Inferior rectus, C. Lateral rectus, D. Superior rectus, E. Superior oblique.
Let's study some ophthalmology. Knowing about the bony boundaries of the orbit and surrounding extraocular muscles is important. This table gives a concise overview of the orbital walls, their corresponding bones, and muscles. The orbital wall refers to the bones that form the eye socket, known as the orbit. The shape of the orbit is roughly quadrilateral or trapezoidal in cross-section, and it consists of several bones. The roof is formed from the frontal bone and the sphenoid lesser wing. The floor by the maxilla, zygomatic, and palatine bones, the medial wall by the lacrimal, ethmoid, maxillary, and sphenoid body, the lateral wall by the zygomatic, sphenoid, greater wing. The corresponding muscles include the recti, the obliques, and the levator palpebrae superioris. You can see the attachment of the various extraocular muscles in this image. Let's look into the actions of each muscle and their nerve supply. Look at this image and navigate to the muscle as I speak. Notice how the muscle pulls on the distal attachment on the eyeball. The medial rectus adducts the eye. The lateral rectus abducts the eye. The superior rectus elevates, adducts, and intorts the eye. The inferior rectus depresses, adducts, and extorts the eye. The superior oblique causes intorsion, depression, and abduction of the eye. The inferior oblique elevates, abducts, and extorts the eye. Testing the extraocular movements is a relatively high-yield concept. Notice what the patient is being instructed to do and the cranial nerve involved. Again, follow the diagram as I go over the instructions. When you ask the patient to look medially, the medial rectus is being tested along with the oculomotor nerve. When you ask the patient to look laterally, the lateral rectus is being tested along with the abducens nerve. When you ask the patient to look laterally and then superiorly, the superior rectus along with the oculomotor nerve are being tested. When you ask the patient to look laterally and inferiorly, the inferior rectus is being tested along with the oculomotor nerve. When you ask the patient to look medially and inferiorly, the superior oblique is being tested along with the trochlear nerve. When you ask the patient to look medially and superiorly, the inferior oblique is being tested along with the oculomotor nerve. You can remember the nerve supply of these corresponding muscles by the formula LR6SO4, which means that the lateral rectus is being supplied by the sixth cranial nerve or the abducens nerve, and the superior oblique is being supplied by the fourth nerve or the trochlear nerve. The rest of the muscles are being supplied by the oculomotor nerve, which is the third cranial nerve. Orbital fractures can be of various types, but you should know the above at the very least. 3 common types of orbital fractures are blowout fracture, which is most common during a fist fight or being hit by a ball in the eye. Medial orbital rim fracture is caused by car accidents. Orbital floor fracture is caused by fall or car accidents. Let's discuss the blowout fracture. This is a fracture of the orbital floor, often due to direct blow to the eye. The bones involved are the maxilla, zygomatic bone, and the palatine bone. Common symptoms include diplopia or double vision, enophthalmos or sunken eye, orbital edema, and possible numbness in the cheek area due to infraorbital nerve involvement. In today's question, a 26-year-old male is brought following a fist fight. When the patient is asked to look laterally, then inferiorly, there is a decrease in the movement, along with enophthalmos. A CT scan confirms an orbital fracture. Which of the following muscles is most likely injured? In this case, we can see from the eye movement being tested that the inferior rectus muscle is being suspected of involvement. Feel free to go over the answer explanations. Here is the key point and the visual to help you recall movement testing. Stay motivated and keep learning. You're nearly there. Thank you for listening. Don't forget to like, share, and subscribe.